Good morning. It's a great pleasure to be here. It's not an exaggeration to say that my involvement with Dr. Chesky's research has changed my life, because my involvement with music and sound generally is the core of my professional and personal life. The most well-known example of hearing loss in music is that of Beethoven, whose progressive deafness made his eventual achievements even more remarkable. But there was a moment at which Beethoven became aware of that. In 1802, he was in the town of Heiligenstadt. Everyone who's taken music history knows this. He wrote a letter to his brothers that he didn't send, expressing his anguish about his progressive deafness. He even hinted that he was considering ending his life because a sense that should be most highly developed in him was going away. He talked about being out with some shepherds and they heard some piping in the distance and he heard nothing. And he felt intense shame. He lived 25 more years. He persisted despite his deafness. He went on to write some of his most important works, like the Fifth and Ninth Symphonies. I learned that I had musician's hearing loss, music-induced hearing loss, in 1998. I was teaching at Western Illinois University. I was taking a class in electronic music. And one day in class, the professor generated pure sine tones of gradually increasing pitch. We reached a point at which the undergraduates in the class were saying, "Ow, stop, it hurts." And I heard nothing. Like Beethoven with the shepherd's piping, I didn't hear a thing. That sent me to the audiological clinic. And I learned, when I got the results, how to read an audiogram. So I was already a professor. I had a bachelor's in jazz studies from UNT, a master's in music theory from UNT, and master's and doctoral degree in ethnomusicology from Columbia University. And yet I had never seen an audiogram, did not know how to read one. So I learned that your hearing acuity is expressed as a series of points that form a line, and it should be between 10 and 20 in that normal hearing range. And you will see my audiogram from 1998 in the next slide. So you should know, as you look at this graphic, that to the degree that the line slopes downward, that means that the sounds in the testing situation had to be that much louder for you to perceive them. A flat line along the top means that you perceive soft sounds evenly across the sound spectrum. And then when they have to be louder, before you will click the indicator that you've perceived that tone, the line dips lower. And so my audiologist said, typical musician, she called it a 4K notch. 4,000 hertz is roughly the top of the piano, 4,183 or 6, I forget. That explained why the top notes of the piano had stopped sounding like ringing notes and they had started sounding like the empty click of the key being depressed. So that explained that. And so I began to think about how this happened. Well, I play saxophone. I've played in a lot of big bands, sitting in front of trumpets and trombones. I've played a lot of jazz gigs, a lot of rock gigs. I've gone to a lot of concerts and without adequate hearing protection. So what I did with that knowledge was to begin wearing foam earplugs, to be aware when I would attend an event and have a sense of fullness in my ears the next day, ringing in the ears, and decrease the time I spent at events that had highly amplified music. When I came, I'm skipping a period, just before I came to UNT, I did ethnomusicological research in Northeast Brazil on popular music. And I was exposed to sound situations so extreme, rock festivals with decibel readings of 110. I was reduced to wearing foam earplugs when I wanted to document this event, foam earplugs within hard shell headphones, and then I inverted the headphones by putting them into the microphone input of the camcorder to be able to have a usable recording, because if I used it as a microphone, if I used a regular microphone, it would be totally distorted. So the sound that I recorded from my research was the sound leaking into my closed headphones and sending that into the inputs. It was just punishing. So I came to UNT in 2001. I saw a poster from a poster session that Chris Chesky had posted on a bulletin board about the speech and hearing clinic at UNT offering hearing exams to students and faculty. I had a hearing exam. I got fitted for musicians' earplugs, which I like better. The sound is better than with foam. I wear these on any gig that's going to have amplification. Every concert that I go to, I take two things. The case for my hearing aids, which I got fitted for in 2010. So if it's not quiet chamber music, I generally take those out. Then I also have my protective musician's earplugs to put those in if it gets too loud. Too loud for those, I leave. So through what I learned with Chris, I tried to do something positive with that knowledge to improve the situation for the students in my program. I chair the Division of Jazz Studies. Dr. Survey said that this kind of change comes from the top, and in my case, I've tried to act in that way. I collaborate with Chris and his students to have measurements made in our rehearsal rooms where the 1 o'clock lab band rehearses and the other bands rehearse. I give a talk on this topic. I tell the students that the protective earplugs are around 150, and these are around 3,000 an ear. They have a choice to protect their hearing now. I let them know that my UNT audiologist saw a percussion major at UNT, 21 years old, with a hearing profile much like mine. And this hearing loss is permanent and progressive. I give a talk on audition day for people auditioning for admission to UNT. On the day we have all our new jazz studies majors meet the faculty, I talk about it for pre-college students in our summer workshops. And when rehearsals run by students in our rehearsal rooms are extremely loud, I intervene in that. So after all those degrees, not only had I never looked at an audiogram, I'd seen all kinds of metronomes, every kind of recorder, but no one who was my teacher ever mentioned a sound pressure level monitor. This is a Radio Shack SPL meter. This tells you how many decibels it is. So I use this to say to the student director of the electric guitar ensemble, you know, you're peaking out at 106 decibels in your concert. Maybe you can modify that. The director's role is one of the key findings of Chris's research. The director has the power to choose the repertoire, to determine the pacing of the rehearsal. More importantly, the director's philosophy, the director's aesthetic is the key issue. I was lucky to have band directors at UNT who subscribed to the aesthetic of loud music doesn't swing. It's the precision of time, it's the blending of timbres and the group coordination that makes music swing. The directors who have a high, faster, louder aesthetic, who think that excitement comes from, let me hear you, let me hear everything you have, I want my ears to bleed on this forte, that is the damaging aesthetic. An emphasis on sound quality, on musicians' health, will give you a better musical result. I was very self-conscious when I started wearing these hearing aids in 2010. I felt that it would diminish my credibility as a music educator if I'm obviously have flawed hearing and I'm evaluating students. I relaxed and I realized that lots of music educators have hearing loss, especially people who play in big bands and amplified music. I'm just the one who is willing to wear these. This is 2015. This illustrates that the hearing loss is progressive. That 70 range is the beginning of severe. So in these two audiograms, you see the progression from 1998 with a lot of readings in the moderate. In 2015, they're in the moderately severe range. And then I guess later on, it'll be below that. And this usable range to the left, up to 4,000, that's the notes on the piano. I can hear fine to do things like rehearse a group and transcribe music. but I'm missing the timbral richness, the sound of brushes on a drum head, soft brushes on cymbals. So that's why I like wearing these hearing aids. The takeaways: music-induced hearing loss can go undetected unless educators create opportunities to raise students' awareness about this. And once that awareness has been raised, as it has been for you today, if you're hearing about some of these things for the first time, you have the responsibility. We all, as music educators, have the responsibility to act in ways that promote the hearing health of our students. Because this is not just something whose effects are limited to the rehearsal time. These carry across the lifespan. We can probably all think of older people in our social circle who isolate themselves because of hearing loss. Their hearing aids don't work well. They don't like being in a noisy room and not hearing what people say. So this question of what happens in public school music education has far-reaching implications. Thanks for listening.
All right, well, good morning. Can everybody hear me? Okay. Well, my name's Amyn Amlani, and I am an audiologist by training. Things that you just heard from Dr. Murphy are things that we hear on a daily basis from musicians in the clinic. Now, I was here at UNT for 11 years. I recently left, and I'm now the chair and professor at the program at the University of Arkansas for Medical Sciences, and it's a joint program with the University of Arkansas at Little Rock. One of the things that we as audiologists are concerned with is your welfare. And what I mean by that is we want you to be able to have your craft, for you to be able to go out into the real world and also communicate, because if you have a hearing loss that's caused by music, guess what? It also translates into your ability to communicate, okay? So we are very, very conscious of that, and we're here to certainly help you. What I want to do today is I want to kind of set the tone for what the audiologist does, what they are, and how we can assist. And so I'm going to start out by talking about what an audiologist is. What an audiologist is we are trained in the treatment and diagnosis as it relates to hearing loss, and then we are also the healthcare professionals that assist as team members when it comes to balance disorders and problems that occur on the auditory brainstem. We work with young ones, we work with old ones, we work with everybody in between. So it's across the lifespan. We're trained over an 8-year period, okay, for most folks. What I mean by that is our undergraduate program is typically in communication sciences and disorders, so it includes speech pathology, it includes anatomy and physiology, chemistry, biology, so forth and so on. And then it's a 4-year doctoral program where we take 3 years of intense courses and 1 year of an intense fellowship year. Now, as part of that training, how does that relate to musicians? Well, in audiology, we're accredited, so we're required to teach courses that are related to occupational health. Now, the federal government doesn't see music as an occupational health hazard. So we train our students to look at factory workers. Now, what I mean by that is we look at individuals who work an 8-hour day for 40 years, and our job is to prevent their hearing loss so that those individuals can have a useful working environment and a quality of life afterwards. Now, in that environment, the noise that's generated is an unwanted noise. So I'll give you an example. If you're in a factory and you're pressing plates, steel plates, that's not a fun sound, right? The crashing and the binging of all that sound is what we're trying to prevent. In music, it's the opposite. You are making, I don't want to call it noise, but you're making sounds. And because you're making sounds, it's a wonderful thing. The problem is it's inherently loud, especially when you get a lot of people. Because it gets loud, you are now putting yourself at risk. Now, in audiology, we're not trained. There is no training, there is no program in the country that looks at music in depth. Most training programs is only 1 to 2 courses, and we look at the factory worker. So when you go to see the audiologist, they have an understanding of what noise is, but they don't have an understanding of what the sounds that you're making. So as a profession and as an educator, we now have responsibilities to serve your community, and we need to do that better. Now, how does this role play out? So let me get into a little more detail about this. When we look at occupational health, there's a set of standards by which we assess factory. There's a problem. There's an assessment, meaning we go out and make measurements to determine how loud those sounds are. There's an engineering control piece that says, hey, if these sounds are this loud, we now need to institute barriers or whatever the case may be to make it softer. If that doesn't work, then we go to an administrative control where you have less time in that environment. And if those pieces don't work, then we put on hearing protectors. That's the way it's supposed to work. In your environment, and most of you are musicians and have been around a long time, how many people have come out and measured your space? Okay, not very many. Now, the interesting thing is in an occupational environment, I know exactly how loud it is because everything is pretty much timed. In music, and this is the beauty of music, it's never the same. You can go see the same show 3 nights in a row, and it will never sound exactly the same. Why? Because music has emotions, and people play differently from day to day based on their emotions. That's the beauty of music. So, as an audiologist, I have to take that into consideration. Now, in terms of making measurements, as Dr. Murphy pointed out, it's important to know how loud things are, but you have to know how loud things are over time, not at just one moment in time. We've done some research that's looked at this, and there are some IT pieces that are being developed and studied that will hopefully in the future allow you to know in real time how loud those environmental sounds are. From a rehabilitative standpoint, you've been a musician for a while, you've been exposed to sounds, and all of a sudden you're now having difficulties. You come see the audiologist. One of the things that we do really well is fit hearing aids. Okay? Now, hearing aids, their purpose is pretty simple. Make soft sounds louder. Make loud sounds softer. That's called amplitude compression. And here's the problem with it as it relates to music. By compressing sounds, we create distortion. When we create distortion, those sounds don't sound normal to you because hearing aids are not designed for music, they're designed for speech. The other piece of this, and this is a disadvantage to us as audiologists, the manufacturers have different algorithms. So in other words, we can go in and set a program for speech, we can set one for music. They are processed differently internally. The Food and Drug Administration, which oversees the classification of hearing aids, doesn't mandate that the manufacturers tell the audiologist how that signal processing works. We studied this a couple of years ago, and what we found was because that compression causes distortion, it causes problems for you. So what the manufacturers do, they uncompress the sound, they actually increase the levels at which the hearing aid amplifier performs, and we found that in actuality may put you at risk for what we call accelerated hearing loss. Okay? So as an audiologist, okay, and as a musician, you have to work closely with your provider to make sure that they're looking out for your interest, and as the audiologist, we have to be more conscious of what the signal process is doing. From a diagnostic standpoint, we are here to help you. Come in, get your hearing tested. When you do get your hearing tested, make sure that you have abstained from loud sounds for at least 14 hours. By doing that, you've reduced any temporary threshold shifts. We can then come in, test your hearing. We can get a baseline, and then we can monitor you over time. That's what we're here for. We can then talk to you about the sounds that you're having difficulties with and some of those pieces in which we can assist you. But at the end of the day, the responsibility is not ours, it's yours. It's your hearing. And you've got to take responsibility for your ability to care for yourself. And there's a number of different ways that you can do that. Number one, everyone's got those earbuds in their ears. Let your ears rest. Gotta let your ears rest. Turn the volume down, but whatever you do, let your ears rest. By letting them rest, you let the normal progression of the anatomy restore itself. The second thing that you can do is monitor yourself. There are apps that are available. Most everybody has a smartphone these days. There are apps that are available, and I'll give you a couple. On the Apple platform, there's one called Ear Trumpet. On the Android version, there's one that's called Hearing Test. Those two apps, they cost about $2. What they will allow you to do is to use your standard headphones, make measurements, and save them so you can now monitor your hearing over time. When you see the need to come in and get your hearing tested professionally, we're more than happy to do that. So again, the take-home message is very simple. We're here to help you. We need to be better educated as professionals. You all as music makers need to take care of your hearing, and together, I think we can make the world a better place. Thank you.